What's going on, boys and girls? It's Josh from preppingplace.com, and today I wanted to kind of get a beginning intro into pre-hospital slash survival slash prepper medicine. I think we'll go with that. The idea behind pre-hospital or prepper medicine is that you are limited on what you can actually do, and you're limited on what you should do. Oftentimes, the nomenclature we use pre-hospital is to get them to definitive therapy or to get them to definitive care. If somebody gets shot in the chest, I don't care how many hyphen chest seals you have or how many chest tubes or needle decompressions you can do in the field, they need a doctor-y person to undo the bullet wound. So there's only so much that we can do pre-hospital, but my job, my goal in pre-hospital medicine is to focus on disaster mitigation en route to definitive therapy. The idea behind pre-hospital medicine is disaster mitigation en route to definitive therapy. In a prepping or a survivalist realm, there may or may not be definitive therapy. So we may have to step up what we can do and what we're ready to do. So first things first, who needs help? How much help do they need? How are we going to go about initiating that help? That's where we're going to start off today. The whole goal for today is that you guys can start with a basic head-to-toe patient assessment. You guys can take it from what's going on, how many people are down, what's the scenario, all the way through, hey doc, hey nurse, hey medic, hey so-and-so, this is what I need. It's very easy for us to jump into the idea that you're going to be doing survival surgery in the back of a cabin out in the mountains. That's not going to happen statistically, but when you guys are out hunting or fishing, there's a chance your buddy could cut his leg open, or you could stumble across a car accident or an ATV wreck or a motorcycle incident. If you've ever seen an auger, that's all they do is cause injuries and maim humans. So we want to know, how do we actually approach this thing in a practical way to be most prepared for the most scenarios? The Pareto Principle, the 80-20 rule, definitely comes into play here. So I want to make sure that we're spending the majority of our time today working on the majority of things that we see, because we spend 80 to 90% of paramedic nursing medical school learning about that 10 to 15%. Because I'll give you a hint. If air is going in and out and the blood is going round and round, you're doing pretty good. But if there's no air going in and out, make it so. If there's no blood going round and round, or it's going round and out, we need to undo that. So if somebody is dead, we need to make them less dead. If somebody is bleeding, we need to make them bleed less. If there's no air coming in and out of their face holes, we should probably remedy that situation. That's the basic overview as far as patient assessment and initial emergent management of a scene. Beyond that, we're going to go into how do we actually approach a scene. I'm going to break it down in a systematic way so you guys can see what we're looking at, why we're looking at it, and how we should approach each individual scenario. All I can give you is a rough template. What I'm going to be going by is the American Heart Association guidelines, as well as the National Registry of EMTs, which handles all of the EMTs and paramedics training nationally. Nursing is a little bit more nuanced, so we're not going to touch any of their specific practicum. So we're going to stay in the emergency pre-hospital realm for the majority of this. Beyond that, I will have a link below for you guys to have printouts so you can get the exact same training and the exact same training sheets that all of the EMTs and paramedics that you may encounter in the field will be having as well. So hopefully, if nothing else, this is educational and exciting for you, and if you guys would comment, like, and subscribe, that'd be great. So let's jump right into that checklist.